This dovish is the question now. Good afternoon, everyone. It is 12:05, so as soon as this, okay, very good. We will get started. I do see people are still logging in. However, we have three really good presentations today, so I do want to start, what has become our new right on time, 5 after. So I don't have a presentation, but I'll just briefly first, I'm sorry, I'm Andy Reese, the Director of Department on Disability Services. And I will briefly go over our COVID data. And then we have three presentations today. Our first presentation is going to be from our colleagues at Department of Healthcare Finance. They're going to be talking about the simplified renewal process for Medicaid for people in the waiver. Next, we'll have a presentation from the Georgetown University Center for Excellence in Developmental Disabilities regarding a project they've been working on supporting parents with intellectual and developmental disabilities. And last, we'll have a presentation from Jose, how did I blank on your last name? Sorry about that. Castrillo. Regarding DDS's customer service process, as well as our DDA formal complaint and RSA administrative review process. So first, briefly, fortunately, August has slowed down a little bit in terms of new COVID diagnoses. There were 9 in the month of August, uh, bringing us up to a total of 895 people supported by DDA who have contracted COVID. And this included 405 people in supported living placements, 203 in their natural homes, 66 in residential habilitation, 164 in intermediate care facilities, and 28 in host homes. Fortunately, of those 9 people that were diagnosed in August, none of them required inpatient treatment for COVID. And we have had 38 COVID-related deaths, the last one being in September of 2021. So first up, we will have Eugene Sims from Department of Healthcare Finance, who's going to share his screen and provide a presentation, which we were really happy to hear about, of the simplified renewal process for Medicaid home and community-based services.
Thank you, Director Reese. Happy to join you all today. My name is Eugene Sims. I am the Policy Director at Department of Healthcare Finance, DC Medicaid by another name. And I'm here today to just give a kind of recap of where we've been through the public health emergency and Medicaid restart, and also talk about a new simplified process that we are implementing for Medicaid HCBS renewals, talk about the reason why, get into what we'll be doing in future months as well, to simplify the renewal process for not just folks in Medicaid HCBS, but also kind of Medicaid LTSS more broadly. With that, I will begin. You can see the structure of the presentation today, but so we, as everyone on this call I'm sure is familiar with, we restarted Medicaid, the annual Medicaid renewal process following the end of the federal continuous eligibility requirement on April 1st, 2023. So that meant instead of just extending everyone's eligibility like we were doing during the period of the COVID-19 PHE, that individuals had to, for the first time in 3 years, complete and submit the renewals so that they could be determined eligible for Medicaid and continue their coverage. So as of March 1st of this year, every Medicaid beneficiary who was enrolled in our program as of April 1st, 2023, has received their first Medicaid renewal, their first initiation of Medicaid recertification after the end of the public health emergency. So, you know, we're in those, we have those 2 groups of our beneficiaries split. Those who are still working on their first kind of Medicaid renewal, those are who may be pending processing of their Medicaid renewal, and those who have been processed and are about to begin their second renewal as we go over the next year. A couple of things that we've seen through the restart process for our HCBS beneficiaries, and I think this also applies to our LTSS beneficiary group more broadly. We have seen a very low rate of beneficiaries who submit a completed renewal and then subsequently get determined ineligible. I believe this rate, as it stood sometime earlier this year, was below 1%, in the 0.3% range. So with that kind of as our background and data and where we're coming from, and I think many of you who are at least providers on this call may know that, you know, there's somewhat of a processing backlog as it relates to Medicaid renewals more broadly, but also the Medicaid HCBS renewals. We have 3 goals as we work to implement kind of a simplified renewal process for this group. First is generally just to simplify the renewal process for HCBS individuals who have already been redetermined eligible once since unwinding. So we have that kind of recent information. Everyone's gone through the conversion renewal process. We want to simplify the upcoming renewal for those folks. Second goal, to help kind of alleviate the processing backlogs that have come associated with HCBS renewals. And third, to kind of take an additional step toward the district's compliance with what's known as federal ex parte renewal requirements. Just briefly, the federal CMS and federal requirements state that DHCF and other state Medicaid agencies have to be in full compliance with what's known as ex parte renewal requirements. Everyone has to have a shot at being passively renewed when their Medicaid recertification comes up to take another step toward compliance with those requirements. We are proposing a simplified renewal process for the majority of our home and community-based waiver enrollees beginning September 1st, 2024. And just so you all know, that's the cohort that would traditionally have had a November 30th Medicaid recert date. Jumped a little. To just give you an overview of the process, we will implement a no-touch renewal strategy for HCBS enrollees beginning September 1st, 2024. That means we will use electronically available information to check level of care, residency for current HCBS waiver enrollees at the moment of recertification. Those enrollees who pass this data check at initiation will have their eligibility extended for a year. That's through their next recertification date. All other individuals who don't pass this check or are excluded from this process will receive the traditional non-pass renewal. And of course, that will need to be submitted and completed back to us for processing. I do want to note that this is different than continuous eligibility that you all were familiar with during the PHE. We will still be reacting to eligibility changes that are reported to the agency during the extended recertification period. So if someone voluntarily terminates their benefit, or they move out of state, or they get admitted to an ICF, or they change setting generally, we're still going to be reacting to those changes. But at renewal, individuals should be experiencing a much more simplified process. So who does this apply to? Beginning September 1st, this process will only apply to our 1915C waiver programs. That's individuals in the EPD waiver, the IDD waiver, the IFS waiver. I think the last two are much more relevant for this group. Currently, individuals in nursing facilities, ICFs, those enrolled in PACE, and beneficiaries with spend down will be excluded from this process for now. That is not to say that over future months, they will not be brought into this process. But for now, with this initial cohort, the nurse facility, ICF, PACE, and beneficiaries with spend down will be excluded. To the extent anyone in an excluded category is unintentionally extended, we have a report of everyone who's going to be subject to this process. We will work with providers, case managers to ensure a non-passive renewal is completed for those individuals. A beneficiary notice. What should a beneficiary expect to see if they are subject to this, if they pass our checks and are subject to this simplified process? Individuals are going to receive a passive notice of a passive renewal. The notice will inform residents that their coverage is being extended for the next 12 months with the traditional caveats that, if you report changes that would therefore make you ineligible, you would of course lose coverage. What's happening for our case managers? So for the IFS and the IDD waiver, we know that DDS has the case managers in-house. We're still asking DDS and the case managers to upload that current level of care documentation through the District Direct Provider Portal. And just like I mentioned, because this is different than continuous eligibility, if someone loses their LOC we will be taking adverse action and they will lose coverage. Of course, we know that for the IDD, IFS population, I think it's pretty rare that someone would not continue to meet LOC. Just reiterating what I've already mentioned about change of circumstances, we will still be reacting to change of circumstances reported to the agency during the extended recertification period. So whether that's an admission to an ICF, different enrollment into a different waiver, death, voluntary termination of benefits, someone moves out of state, we are still reacting to and processing those changes that are reported to us during that time. So of course, case managers must continue to submit those changes of circumstance to us during this period. The expected impact, of course, is simplified renewal process. Everything should be smoother for our case managers, our enrollees, our eligibility processors, our providers. We think this will be a great boon to the renewal process for all those impacted. This marks kind of a continuation of the things that you've seen us do over the past year since Medicaid restart. We've implemented non-magi extensions. We've extended our 90-day grace. We've made a universal kind of 90-day grace period. We're not checking resources at renewal. We've taken all those steps to kind of simplify and make easy the renewal process for as many Medicaid beneficiaries as possible. And this is kind of just another step in that direction. We expect to expand the simplified renewal process for other LTSS groups over the next year. And of course, we'll communicate any anticipated changes in the Medicaid, the simplified renewal process through meetings like this one, transmittals, Medicaid directors letters, my own biweekly meeting that many of you I'm certain attend. And of course, we're working with CMS to receive their full concurrence with this proposal. And if we are going to make any changes to this process to comply with additional requirements from CMS, of course, those will be communicated as well. I've kept my presentation brief. I'm here. I believe some of my other DHCF colleagues are here. If there are questions about this process, of course, feel free to reach out to DDS, myself. And of course, if you are familiar with kind of the Medicaid restart process in general, we have a great landing page at the DHCF website /Medicaid-renewal that has kind of keeps everyone up to date with all the things DHCF is doing as it relates to Medicaid restart and the Medicaid renewal process. Director Reese, I'm happy to take any questions.
Thank you very much, Eugene. That was really helpful. And we do have so far one question in the chat, which is, how long do you anticipate the simplified renewal process will remain in place indefinitely?
So for at least a year, that's our current thinking. This is going to be our bridge to get to full LTSS ex parte. So it's probably, we think on the DHCF side, we think it's going to take us a year to get to full ex parte for our HCBS LTSS beneficiaries. So that's how long we're anticipating having this process in place. And of course, if there's any changes to that, we'll communicate that with our stakeholders.
Thank you. And I don't see any other questions in the chat. So we will move on to the next presentation. Thanks very much, Eugene. And
thank you, Director Reese.
So next up, we have two colleagues from the Georgetown University Center for Excellence in Developmental Disabilities. And I think we're sharing the slides for them. And yes. I know that Robin is presenting, and I know that you have someone else with you, and I didn't get their name before we started. I apologize. So I will turn it over to Robin so that she can introduce her colleague and begin her presentation.
So thank you, Director Reese. I'm Robin Shafford. I'm on the faculty of the Georgetown University Center for Excellence in Developmental Disabilities, and I'm here with my colleague, Angela Castillo, to talk to you about a project we've been working on really over the last 4 years. But before that, I'd just like to put this project in context for a minute. So having children and raising a family are fundamental civil and human rights. And people with disabilities, people with intellectual and developmental disabilities and other disabilities have the same rights and responsibilities in that area as everyone does. And I think it's fair to say that over the last 2 or 3 decades, the District of Columbia has really been at the forefront of supporting people with intellectual and developmental disabilities in DC to exercise those rights and to support them in raising their families. And during the course of this presentation, we'll hear about some of the work that we've done at Georgetown and some of the work that the Department on Disability Services has done to support parents with IDD in the district, and also that the DC Department, the DC Health, our Department of Health, has funded us to do as well. So so most recently, about 4 years ago, we initially got a grant, and we've been working on it on 2 different grants over the last 4 years, and we're here to talk to you about that work, and they're called Transition Supports for Parents with Intellectual and Developmental Disabilities. And the idea is, how do we support parents with IDD to help them raise their children in the District of Columbia? So if we could go to the next slide, please. Next slide, please. Or can I move my slides?
Before we move on with the slides, I don't think it's just us. Are people seeing the slide? Because I see a bunch of black squares in front of that. Yeah.
Yes.
It's not.
It may be the view that they're in.
No, I see some black, I see parts of the slides. Okay, so while we're fixing the slides, I'll just talk a little bit about the project goal. So we received some funding from the Administration on Community Living from the Department of Health and Human Services to create an action plan across multiple of the systems in DC to enable parents with IDD to support and raise their children with and without disabilities throughout the life course in all of our DC communities in which they live. So next slide, please. So this is the team that we put together from the Georgetown USID. I hope some of you will recognize some of the players in this. We're very much a team with interdisciplinary expertise. And we have, we have nice pictures, but if you go to the next slide, you'll see a list of the organizations and entities in DC, both the DC government agencies and private nonprofits and others that we brought together. These are all organizations and agencies that work with parents with intellectual and developmental disabilities. And in particular, I want to thank Director Reese, Deputy Director Woodland, and Musu Fafanu and others from DDS for really working with us on this. DDS and some of the other agencies that we've worked with in this partnership have a lot of experience working and expertise working with people with intellectual and developmental disabilities, but a number of our partners really don't. They're working in other systems in the District of Columbia, and they may know that they're working with children with developmental disabilities, but they don't always focus on the fact that some of the parents of children with and without disabilities also have disabilities. So a lot of our work initially was to get some universal understandings around what parents with intellectual and developmental disabilities need to support their families. So next slide, please. So we have these organizational partners, but I'm going to turn things over to Angela to talk about our parent partners.
Thank you so much, Robin. So yes, we definitely want to recognize our parent partners. The first 3, Denise Arrington, Arnetta Kinney, and Mr. and Mrs. Thornton, are from the TIP partnership. And Lakeisha Neal and Lysandra Simmons were supporting us from the Parent Support Home Visiting Program, also a DC program. And we just wanted to share that we worked with the parent partners to literally include them in every part of this partnership, from prepping them and debriefing them after every quarterly meeting, to obtaining their feedback, their input, their edits on all the resources that we're going to talk about today, to actually starring in the video series, which we will talk about more in a moment. So another way that we kind of share why we are partnering, in addition to all the great things that Robin just shared, is that we share quotes from the parents and the grandparents that we support in this program through the tip. And so here we have a quote from Benjamin, a former parent enrolled in that parenting support program. And he says here, people think just because you have a disability, you can't be a good dad or mom. That isn't true at all. I'm not saying it's easy. I just know I do better as a dad when I have a crew of people who help me, or services with people that have a plan for how to work with a dad like me. That's what makes it easier for me and my sons. And so again, whether it's you know, a parent, a grandparent, as Robin said, we're looking to make it easier, make it more accessible for parents with intellectual and developmental disability to support their families, just as everyone else. And so for the next slide.
In the background.
And we're getting-
Angela, I'm sorry, before you move on, Charlisa, can we do something about all the boxes again? Sorry, it's just,
Oh,
y'all
yeah,
have a
I
great
understand.
deck there, and I want to be able to see it, and I imagine everyone else does too.
Yeah, no problem.
So while we're fixing the slides, this project that we're working on formally comes to an end at the end of this month, and we wanted to ask for this time today so we could share with you the resources that we're going to be rolling out as we end this project, and then also hear from you about what additional areas we should be thinking of at the end of this to talk with parents with IDD. So we want to talk today about 3 types of resources that we're rolling out. And the first 2 are really for more for the organizational partners, policy and practice guides and training modules. And then the last is really geared for parents, and it's a series of videos. So we'll go through each of these in a little bit more depth. If we could go to the next slide, please, Charlisa.
Before I move on, I just want to confirm you all aren't seeing the boxes.
The
I couldn't see them on my
boxes are gone. Boxes
Okay,
need to
thank
be
you.
gone. Thank you. So if you could go to the next one. So we have drafted and are and finalized, they'll be up on our website shortly, a series of 7 policy and practice guides to support the agencies and organizations and our partnerships and other organizations and agencies to develop new or adapt their existing policies to assist parents with the lived experience of intellectual and developmental disabilities. And the 7 areas that are covered are self-determination, supported decision-making, disclosure of disability status, reasonable accommodations, literacy, augmentative alternative communication, and health literacy. And again, these are areas that those of us who work every day in the IDD community are familiar with, but a lot of people who work in the child welfare system or the education system or DC Parks and Rec or any of the other systems that parents interact with may not have really had the level of familiarity with these concepts that many of us have. So in each of these guides, we start by introducing the topic and providing an overview, and then defining it, and then talking about why that policy or practice is important for parents with IDD. And then we suggest some language for policies that organizations and agencies could implement, and some practices that they could. And one of the things I've learned over my decades working in this field is a lot of the time, policies and practices that are good for people with intellectual and developmental disabilities are good for people in general. So we think that if the organizations, agencies that we're working with implement these policies and practices, they'll not only be better at supporting parents with intellectual and developmental disabilities, but they'll be better at supporting parents as a whole. So these will be available on our website. We'll have some hard copies of them, but we know most people today don't want hard copies of them. I'm going to say as a disclosure, these are primarily intended for the organizations and agencies, so we don't have plain language versions of them, but one of the things that the policies and practices talk about is how to create plain language versions of things. If you could go to the next slide, please. We also, the first year of our grant was really a planning grant, and we did a number of webinars for our partners in those, and we've turned those into training modules that are available if anybody would like to access them. I know there are a lot of providers on the line. If you think these would be helpful and you want to access them, please contact us and we'll find a way to do that. And one of which is, as we said, this is a project to support parents as their children move through the life transitions. And so we talked about what transition means, not just the type of transition that we talk about in education, from high school to after school life, but broadly from a life course perspective, what do transitions look like? And then also we worked to help people define and understand intellectual disability and developmental disability. So if you're interested in those training modules, please let us know. And now I'm going to turn things back to Angela to talk about the video series.
Thanks again. So the video series that we developed in partnership and in collaboration with parents with IDD in the DC area is accessing and using multi-systems family supports for parents with IDD. And of course, we're helping to, again, navigate these very complex systems in DC through the use of video. And so we ended up with one video for early intervention system, 2 for education. That is a 2-part series. We also have a 2-part series for healthcare. And then the child welfare system will be 1 video, which is still in process and will be done very shortly. Again, also available on this TIP webpage that we're going to show you in just a minute. And we just wanted to explain that, we included a parent with lived experience of IDD from writing the script to being in the video, all the way to reviewing it for accessibility and for edits once the videos were complete. So again, really fully integrated in this process. So this video we're going to see today, we will only see the first 3 minutes. It is actually 12 minutes long. But we wanted you to see the very beginning so you can see some of the accessibility features that we built in. And this video is going to include parent partner Arnetta Kinney. So if Shalisa can help us get to, wonderful. Okay, so this is, we're going to open up the actual website for you. So again, you can see where the video series and all these other great resources live online. And then we'll just play the beginning of the video. And of course, as Robin said, we're hoping that you will not only access this information, but share it widely. So we appreciate the opportunity to be here today. Okay, so here we can see is the page where all the videos are listed, and this larger screen at the very top is early intervention.
The early intervention system. The Georgetown University's Center for Excellence in Developmental Disabilities, GUCED, presents the Transition Implementation Partnership, TIP, video series. The TIP video series was created to help parents with intellectual and developmental disabilities understand how to navigate systems in the District of Columbia. This video was made in partnership with local parents. Enjoy this video at your own pace. This video contains a lot of information and is meant to be paused when needed. You can watch the sections of the video again that are most helpful to you. You can also ask someone else to watch this video with you for support. Thanks for watching. The DC Early Intervention System. Featuring
My name is Arnetta Kinney. I'm a black young lady, and I'm a beautiful person. I'm a parent with two children. What is the early intervention system for?
The early intervention system supports families that have concerns about their young child's development. As young children grow, we see many changes in their development. The way they move their bodies, speak and understand language, form relationships, manage their emotions, and understand the world around them. Not all children develop and grow at the same rate and in the same way. Some children need help with their development. Early intervention specialists help children with their development and help families to meet the needs of their infant or toddler. The District of Columbia Early Intervention System is called Strong Start. It is a program for families with children from the time they are born up to their 3rd birthday. Strong Start focuses on children who have a developmental delay or disability, or are at risk of having a delay or disability. Sometimes parents may choose for their children to continue to receive services under this program up to 4 years of age. Summary of this section. If you are worried about the way your child is growing, Strong Start can help. Strong Start serves children who have or are at risk for having a developmental delay or disability.
What is a developmental delay?
A developmental delay can occur if a child cannot do things that most children their age can do. An early intervention specialist looks closely at development, including your child's ability to.
Thank you so much for sharing the beginning of that. I'm sorry again about the boxes, but it is a lovely video, again, with animation and participation from our parent partner, actress, Miss Kinney. And so what we want to do, if I can see the next slide, I just want to briefly go over some of the feedback that the parent partners gave us after they, got to see themselves on screen and got to see how their input was incorporated in the videos themselves. And so we have a slide here that just shares a little bit about their thoughts and some quote bubbles that we'll put up in just a second. And also while we're waiting, the videos are will be available in ASL as well, and linked to the site with downloadable scripts. So again, we're very excited about that. So parent partner feedback. So we have quotes like, I liked Miss Kinney's part a lot. I like how she did her part. I can relate to this video myself, and other parents will too. The video will be good to show parents at the very beginning so they can find good help. I can see new parents using this when they are just learning about the healthcare system. Remember, that's a 2-part video series we have. And parents with IDD don't have to feel alone when navigating these systems. And so again, just a little bit of feedback, kind of like the ultimate nothing about us without us experience for us. And it was an honor to be able to work with the parent partners and be able to put them into the project, into these resources, and the pride that they felt through the process was also very rewarding. So again, thanks for allowing us to share this part of the resources, and I'll turn it back to Robin.
Right. And I just want to underscore that, as Angela said, we got parent feedback through every part of this process, including when I talked about the policy and practice guides. Who can tell you more about what is important in terms of the policies and practices that you need to support parents with IDD than parents with IDD. So also with those guides, even though the guides themselves are geared to support the organizations and agencies, the content in them we very much benefited from and sought out and used the input of the parent partners in that work as well. So if we could go on to the next slide, please. We want to again thank DDS for inviting us in June to come to the meeting of service coordinators and supervisors, where we talked to 65 people about the work we were doing, and we focused on the concept of person-centered planning and support in the context of parents with IDD. So looking at what was important to the parents and what was important for the parents, and including parenting goals in the ISP, goals that are for the parent, not goals for the children, but goals for the parent to become a stronger parent in the ISP. And we also talked, and I wanted to spend a few minutes on this part, about the available resources. DC is a leader in providing parenting support as a waiver service. And so one of the services that is available under the IDD and I believe the IFS waiver is to support, to give parents support in learning how to be parents. So the IDD waiver is not taking care of the children. This waiver service supports parents in their work as parents, if that's a clear distinction. If not, I'll try again. Through DC Health, Georgetown runs a home visiting program. It's one of a series of home visiting programs that DC Health funds, and it provides home visits to the parents. And the people who are doing the home visitors are specifically have specific expertise in supporting parents with intellectual and developmental disabilities. We talked also about a parenting curriculum that those home visiting program supports are trained in, that's tailored to parents with intellectual and developmental disabilities. And then, of course, we shared with the service coordinators and supervisors information on the videos that we just shared with you. So that was a terrific opportunity to provide training and technical assistance to DDS, and we look forward to continuing this partnership to support our parents, even as this particular part of that work draws to a close. So then finally, we want to disseminate all of this information, and as these last few products become final, we're updating the website of the Georgetown University Center for Excellence in Developmental Disabilities, and we will have the information not only about the project ourselves, but the type of information you've seen about our team and our partners. We'll have links to the policy and practice guides, links to the videos, and links to the training modules that we've all gone over here. And if we could go to the last slide, which is just a follow-up, please contact us if you want to talk about any of this work. Our colleague Sophia Hassan's email is on here, but I'm about to put my email in the chat, and I'm sure that Angela will do the same. And we invite you to reach out to us if you're supporting parents with IDD, either as a service provider or in your family, or if you're a parent with IDD and some of these services might be helpful to you. Please, we'd love to hear from you. And I will stop talking, and please ask any questions.
I also put the webpage in the chat as well, Robin. Thank you so much.
Thank you all.
That was great. Thank you. I'm looking forward to checking out all those resources. That looks really helpful. And as you said, I think that plain language guidance for anyone would be helpful. So
Plain language guidance is helpful, and good policy, good agency policy for people with IDD is good agency or organizational policy. And I learned that when I did employment law. And it's true across all of these areas.
And as Angela said, the link for all of these resources is in the chat that people can access. Someone else commented, great resources. As always, the slide decks will be available on our website by the middle of next week. So people will be able to see all of the resources and link from there. Okay, if there are no other questions, both Robin and Angela's contact is in the chat. So if you have questions, you want to just ask them directly, you can email them, or you can always type into the chat and they can answer before the end of our meeting today. So our next presentation is from Jose Castrillo here at DDS. And he is going to speak today about DDS's customer service process, as well as our DDA formal complaint process and the RSA informal review process.
See if I can share the screen.
Give him just a second to begin sharing his screen, and then he'll get started.
At the beginning. Good morning, everyone. Good afternoon. My name is Jose Castrillo. I work in the Department of Disability Service in the Department Administration. I'm the Quality Improvement Supervisor, and today I will go over the customer service, the formal complaint, and appeal decisions made by RSA. Customer service provider, the opportunity. So the opportunity to information, anytime we have a hotline, we receive an email through the customer services. It gives the opportunity for people to request information about our services, to communicate issues and concerns about their services, staff, providers. Sometimes people give us concerns about unrelated issues.
I'm sorry to interrupt. The captioner is having a hard time hearing. You're a bit low. If you don't mind speaking up just a tad bit.
Yes. So the opportunity for the customer service is to communicate issues and concerns. We resolve the concerns related to DDS services and a request to assist the new potential providers. Providers sometimes they are applying or try to become a provider for DDS, RSA, can contact directly to us and we can send the information on what they need, how to apply. We refer them to website links or send them material about how to become a provider. Even though we resolve concerns related to DDS only, we receive a lot of requests from other states. They think that we are federal. Other states requesting information about other DDS disability services. We always try to help them too. We have kind of accumulated a lot of information from other states, and we send them the link. But that's what we do. The customer service. So how the customer service team process all the inquiries. Once our department is contacted, all the inquiries and concerns relevant to DDS providers or persons supported are documented in a system. We call it IQ, the Internet Quorum System, that is managed by the District of Columbia. Many other agencies use it to put it's like open a service tickets. We assign that IQ to the proper supervisor at DDS, can be DDD, can be DDS, can be DDA, RSA, and of course, they're all gonna have a deadline to comply, to contact the person, try to resolve the inquiry that comes through the customer service system. Those are some of the numbers that we received through the last year. I sorted by the top. Most of them are inquire and receive information about services, feedback about the status are one of the big ones. Can be status about not only for applying for services, can be status about when you want to become a provider, status about cases in terms of funding, applications, changes for their services, etc. So there is a lot of cases that we send them to the supervisors for them to close the request, concern, inquiry. And those are some of the numbers that you can see. Just this current year, we have received 112 inquiries. Not all the anytime somebody contacts the service, the customer service line, not all will we open an IQ. An IQ, required a week or 2 weeks to be closed. If somebody just call us for the number of an X person, we right away give it to them. If somebody just asks for the website that related to service coordinators, RSA information, we just right away try to help that person immediately at the same day. So many requests that we receive on the weekly basis are not going to be posted here. It will be taking for me more time to open a case than help the person directly. So also to help us to resolve any differences, we have that team. That is the number that people can contact us directly. You can send an email if you have documentations that are not clear, documentation that you want more information to. You can send us to that email, and we for sure we will help taking care of that request inquiry. There is a form for the customer services. That's the link. And I want to be sure that everybody who uses that form, they can also enter requires or concerns anonymously. You can also contact customer service and let us know. I want to report something that I don't feel comfortable tell you who am I, and I want to report something, be anonymous, and we will honor that request. We're not going to tell the other party or whatever who you are. So be sure that you make that clear that you want to remain anonymous. In those days, everybody can read the number of the telephone that you're using to call. So ensure that we know that, and we will honor that request. Okay, and many other requests anonymously, we have follow up, and in some cases we have even entered incidents on it. So let's be sure. Formal complaint system. Now, the formal complaint system is for DDA division, people receiving services for the developmental disability. It can be used for the denial, delay, reductions, or termination of DDS support services, including the medical waiver. Examples, somebody refuses to provide services or support that you are eligible to receive. Formal complaints got to be related to the person receiving services. Many people have used the formal complaints to request information, to complaints about the provider, complaints about staff that they work with, and we, of course, we redirect those, and I'm going to talk a little bit about that later. But, for example, if you cannot change your service coordinator, the service coordinator will not approve a case transfer, you can always fill a formal complaint system, use it to resolve any problems. You can also use the formal complaint system to complain about the provider. Just be sure that we will redirect you. If the provider doesn't know about that complaint, we will redirect you to the provider and ask the provider to explain in their complaint system, and we will request eventually a report to the provider, give the person the resolution. Okay. Again, the provider you complain with If you formal complaints about the provider, each provider has the formal complaint process system. You are supposed to first file the complaint with the provider. The provider will have to respond to that complaint within 30 days. And if you decide that you're going to follow up with that complaint because you're not satisfied with their resolution, then you can send us a request and we're going to enter a formal complaint system. We will require for you to send us that report and we're going to follow through that request. Formal complaint can be filed by who? By the person who received DDS supports, the guardian or the other legal decision on their behalf. Family members, friends, advocates, and other people can also file a complaint if the person gives the permission, if the person knows about it. Many times, and I have to say that, not many times, but a few times we have received formal complaints. People take their time to fill the form and all that, and the person supporting doesn't even know that the family, friend is filing for that formal complaint. So what we do in those cases, we still want to hear about what is the complaint. We transfer that to the customer services. And if that is a case for an IQ, we're going to open an IQ. We're going to send that complaint to the supervisor and find out a resolution of that. All right? That will not be considered a formal complaint. It's a time limit for you to sign a formal complaint or file a formal complaint. 90 days after the problem happened. A full 3 months, you have to file a formal complaint. Any day, of course, you need more time. There is a good reason for missing the deadline. You can let us know and we can evaluate if it's still going to be accepted. All right, that is the information to file a formal complaint. You have 3 ways. You can send us a letter by mail. You can contact us directly. If you want us to follow the formal complaint, we're going to help you out and file the form. You can send us a direct email to the DDS complaint at dc.gov. You can also, that's one of the things that we prefer, file a formal complaint in the formal complaint form. The link is in the slide there. That is a very good way because people can take their time and we're not going to miss any questions that we're going to need in order to process that request. Okay. Now, what happens if you use the formal complaint to report an incident in which the information is about abuse, neglect, or exploitation? So first of all, the first thing we do is enter an incident ourselves. We're going to gather more information and we're going to contact the incident management and enforcement unit, IMU, about it. They're going to follow the process and conduct an investigation. And usually their investigation resolve the problem. Of course, this is a more serious way to resolve those formal complaints. We're going to send an investigation. We're going to follow up within 72 hours. If we have to go and visit the location, interview people right away, we will do it. So, however, if after the investigation the issue has not been resolved, then we're going to continue with the formal complaint after the investigation has been completed and corrective action plans have been submitted by the provider, etc. Follow up the recommendation of our IMU department. So how do we process the formal complaints? Within 14 days, when we assign, you will receive a letter accepting the formal complaint, and the supervisor assigned to resolve the formal complaint will give us all the resolution. And again, we're going to send you a letter for what will be resolved. That's the station 1, an internal DDS review. 99% of the cases are resolved this way. And I've been working here almost 2 years, and they all have been resolved using the internal DDS reviews. Try to make the people, understandable or happy about the resolutions. If you're not happy with the the letter that we send you, there is an external review. That is the other option. And the external review, you have to contact us within 14 days for us to start the internal review decision. So what is the external review? That would be the stage 2. External reviewer is a person that is not employed by DDS, or the provider is a person that will see and hear both parties, not only DDS, but the provider and the person. He or she will have 45 days to work, to resolve using different approaches, negotiation, interviews, meetings. They're going to review documentation, see the complaints is about some funding problems, something like that. And the person who is using or requesting the external review will have 17 days to send comments or report to DDS. Okay? That reviewer will come during the station 3, send all the report of the findings and make recommendations to our DDS director. The DDS director will make a decision within 22 days, receiving the external review, and that it will be final for us. The stage 3 will be final. The decision of the DDS director, Mr. Reese, will be their final, but still you will receive a letter in which gives the options to appeal to the Office of Administrative Hearing. Okay? That will be the options after, if you're not happy with the station 3, the decision of our DDS director. Now, things that you might not file using the DDS complaint system. When you're trying to file complaints about DDA initially, eligibility appeals, again, incidents that are under investigation for abuse, let's say abuse, neglect, of exploitation, because we are under the investigation. So then we might need to finish for them to do that investigation. Things that are not related to DDS. And many things, as I said before, people use the formal complaint system to complain about unrelated issues. DDA, RSA, or no, DDA, the DDA. The complaint information is not the same for a pending legal case. Sometimes we have DDS legal cases that are pending and will take time, and people are complaining about those. So those are not eligible to use or to be processed through the complaint system. And of course, if the complaint is about RSA, Rehabilitation Service Administration decisions, I'm going to talk a little bit about those in a minute. Okay. So those are information. We have a website in which you can file the complaint, and you can use that form. Again, it's there. We have a website that can give you more information about the process and the policies. Okay. Things that you need to know: you cannot be treated unfairly or badly if you're trying to file a complaint. No retaliation is allowed. The complaint involves abuse and neglect. Again, you must report the incident to our IMU division, and you cannot have the exact same complaint filed anywhere else, because DDS will not be able to resolve it. Right? RSA due process. All right. The Rehabilitation Service Administration has a due process. And the RSA is required to inform the person writing of cases, closure, suspension, reduction, or denials of services. So you will receive a letter. If you disagree with that decision, you have the right to appeal the decision by requesting the following. You can request an informal administrative review meeting. You can request a mediation through the DC Office of Administration Hearing. You can request an impartial due process of hearing with OAH. So what is the administration review meeting? It is a process to resolve your concerns what you don't like about the decision letter. It gives the opportunity for you or the person that is trying to help you with the complaint to meet with the RSA deputy director or his designee and to help resolve the concern that you might have about the related issues. It might involve fact-factoring, interviews, negotiation, documentation review, etc. This is a voluntary, and of course, it will not deny delayed any VR services if you want to have an informal administrative meeting. Schedule one of those meetings. Okay. And then this is the way that you can request an informal administrative review meeting. You have 10 days. Remember, after you receive that decision letter, you have 10 days of the receipt of that letter to request that meeting. You can send us a request to my supervisor, Justin Brown, deputy director, and that is the address. And you can or send us an email. Include, please, the decision letter that you received. That would be great. Or you can send us the request based on that decision. All right. You can also request an impartial due process hearing with OHA. If you, after that meeting that I just explained, informal administrative meeting, you're still not happy, you can request within 15 days the due process hearing with OHA, right? It might include mediation. Mediation is voluntary, it's informal. They use a neutral party, a person that it doesn't work for us, a person that is not related to the case, who will help you to mediate and resolve any disagreement that we have. You can also request a hearing before OAH in the absence of that administrative review meeting within 30 days of the action. Okay. So those are the ones. Now I will open to any questions that you might have. So that's my presentation. I put my information in there. If you have any question, you can call me directly. That's my cell phone, and that will be my email. Any suggestions or concerns that you have to improve the way we manage our complaint system and the customer service will be welcome.
And as with all the presentations, as I said, it will be on our website by the middle of next week. So perhaps, Charlisa, can you put exactly where on the website people can find the presentations? Are there any other questions while I look to see if I can find that? So I haven't seen it yet, but what I can tell you is if you just go to dds.dc.gov and there's a search button at the top, if you type in DDS Community Forum August, once it's available, you'll be able to then click on that link there and it'll take you right there. Oh,
So
okay,
just put
now
the
I
link
see
in
where
there.
it's here. Okay, so.
I also put the link to the website in the chat. If anyone
Thank-
wants to save it in their favorites, we always upload all PowerPoints by Wednesday the following week.
Okay. If there are not any other questions, have a wonderful day, everyone. Enjoy this beautiful weekend that's coming up. And we will see everyone in September. Thank you.